White blood cells are known as leukocytes. Leuko means white, so it's white cells. Unless you're really sick, they make up of less than 1% of the total blood volume. Hematocrit and plasma take up most of the rest. They are transported via the blood. They are considered blood cells. They're made from the hematopoietic stem cells in the bone marrow, so that they come from the same cell stock as the red blood cells. So they are blood cells, but they usually work in the interstitial fluid outside of the blood. They have to leave the capillaries to do it, and we call leaving the capillaries diapedesis, which means to step through. Pedal, so diapedesis, to step through. Sometimes it's called emigration, which means to leave. The diapedesis was the preferred word for the longest time, and recently emigration seems to be the preferred word. Once they leave the blood, they kind of have to self-propel, so they move like amoeba. They kind of crawl along through the interstitial fluid. What they do is they're part of the immune response. They prevent or they help fight infections and problems like that. So anytime we have an infection, we make more of them. And so by doing blood work and counting the number of white blood cells, we can really indicate whether there's a viral or a bacterial infection just by having this increased count of white blood cells. We call that leukocytosis, which means the condition of white blood cells. And it happens when the white blood cells are over 11,000 per cubic millimeter. For my purposes, you don't have to know the numbers usually, but the concept is in fact important. So leukocytes are far less than platelets and way far less than the red blood cells. And there are 5 fundamental types of white blood cells. There's more subtypes, but fundamentally there are 5 types. And these all have different functions. And because they have different functions, they have different things in them. Now, some of them, 3 of them, have got granules that stain. These are inclusions in the cytoplasm that take up stain and help the cell function. So we call the ones that have the granules the granulocytes, which means granule cells. And there's 2 different stains that get mixed together when you stain cells. There is a blue stain, which is the base stain, and there's a red stain called eosin, and they mix together all the time, and it comes mixed together. And when you put it on the cell, some of the cells, the granules, take up eosin, some of them take up just the blue, the base stain, and some of them take up both types of stains and end up coming out purple. So we call the ones that take up the eosin eosinophils, loves eosin. The ones that take up the base, basophils, and the ones that take up both are neutrophils. Neutrophils are by far the most common. Actually, they're the most common type of white blood cell, and they stain purple. Now, there are 2 other types of white blood cells that actually don't have visible granules. They don't take up the stain, and they're called the agranulocytes, without granules cells. The vast majority of them are lymphocytes, and the other type are monocytes, which will become macrophages. After diapedesis, a monocyte is known as a macrophage. And the order that we find them in are neutrophils first, lymphocytes are the second most common. Monocytes are the third most common. Eosinophils are fourth, and basophils are the least common. And the acronym for that is Never Let Monkeys Eat Bananas. And that gives you the order of what you see. So the granulocytes, they're fairly large. They have big lobe nuclei in them. They're phagocytes. They don't stick around for a long time. They're fairly short-lived. We use them for infection and then get rid of them. You know, there's still a base number, but for the most part, the high counts go down very quickly. So the most numerous are the neutrophils. Sometimes they're called polymorphonuclear leukocytes. People that do blood work and count these things call them polys. So you'll oftentimes see in reports that the poly count is high, but they're really called polymorphonuclear leukocytes because the nucleus has many shapes. Takes up both types of stains, and so they end up being purple. And what's in the granules is hydrolytic enzymes. So they eat bacteria and they kill bacteria with these hydrolytic enzymes. Eosinophils tend to stain red, and they have big lysosomes in them. And what they do is they deal with parasites, usually worms, things that are infections that are too big to be phagocytized. So basically, what they do is they attach to the worm and they puke up these lysosome granules, and they basically digest the worm from the outside. Now they can be phagocytic. They tend to also clean up antibody-antigen complexes in the cleanup stage after an immune response. They help modulate the immune response too. Basophils are the least common white blood cell. Their granules stain dark, like a dark purple, almost a bluey black. And what they have is in the granules is histamine, and histamine is a vasodilator, so it's an inflammatory chemical. What they end up doing is they release their histamine at the site of an infection in order to cause vasodilation, which slows the blood flow through that area, which then means that the other white blood cells are not being swept away as quickly. There's more time to engage the antigen or the invader and get rid of it. It also is involved in something called chemotaxis, which is attracting the neutrophils and the macrophages and that kind of thing to that site. So they're very much involved with releasing histamine that causes inflammation. That's why when you have an infection, say, in your nose, the inflammation is what's giving you the symptoms. It's attracting the other white blood cells to clean it up, and that battle is what causes a lot of the exudate and a lot of the stuff that happens. But if you don't want those symptoms, you take antihistamine. It helps with the symptoms, but it also detracts from the positive elements of inflammation. It probably means that you're infected for longer. They end up looking like this. You can see that the neutrophil has got lots of lobes in its thing, and it has these purple granules. The red granules with 2 lobes are the eosinophils, and the basophils are this dark blue, black histamine granules. The agranulocytes have no granules. They tend to have these kidney-shaped nuclei, and they have other things to do in the immune response. So the lymphocytes are large. Their nucleus stains dark purple. They have a little bit of cytoplasm around the edges, but they are mostly nucleus. You find them as soon as they are made. They leave the blood. They go into lymphoid tissue in your tonsils and your spleen and Peyer's patches and all of that stuff. So we find that in this reticular connective tissue, lymphatic tissue, lymphoid tissue, and they're critical to immunity. The natural killer cells are lymphocytes. B cells are lymphocytes, and T cells are lymphocytes, helper Ts, all of that. They're all lymphocytes. They all come from the same stock. So the T cells, as we know from last semester, kill virus-infected cells, or your own body cells that are tumors, or have a problem with them. The B cells are the progeny, have progeny called plasma cells that make antibodies, and antibodies are part of the humoral response. The monocytes are huge cells, which why they're called macrophages when they leave the bloodstream. They have a lot of cytoplasm because they're really large phagocytes. They become antigen presenting cells, so they're used not only to clean up things, but they will present antigens to the lymphocytes and start the whole specific immune response. They're critically important, huge important. So you can see the lymphocyte, hardly any cytoplasm, monocyte, very large cell, lots of cytoplasm. So so really we have red blood cells coming from the hemocytoblasts, neutrophils, eosinophils, and basophils, which are the granulocytes, the agranulocytes, the lymphocytes, and the monocytes. It's found as never let monkeys eat bananas. And the last of the formed elements is platelets. So where do the white blood cells come from? They come from the exact same place, and we call the making of them leukopoiesis. Now, there's not a leukopoietin hormone. It's a various other types of chemical messengers, interleukins, colony-stimulating factors, etc. But they all come from the original hemocytoblast, from that original pluripotent stem cell. So over here, we'll see this. This is the stem cell. Now, we could just as easily put over here a branch off of this that becomes a erythrocyte. But very early, depending on what we need, we either have the lymphoid stem cells, which then become lymphocytes, right? Or we have the myeloid stem cells, which become myeloblasts and etc., and then give rise to eosinophils, basophils, neutrophils, and monocytes. Now, you will eventually in pathology classes, and definitely when you're in practice, you will talk about myeloid leukemia, or that's a common thing. So what it means is that these are the cells that are screwed up. Very actually dangerous, life-threatening type of leukemia. So the platelets are little fragments of these very, very, very large cells called megakaryocytes. Mega means large, karyo means body, and so it's large body cells. It's regulated by an enzyme or a hormone called thrombopoietin, because the other name for platelets, the old name for platelets, was thrombocytes. They stain blue, they have granules, and the granules are serotonin, calcium, all kinds of different things. But basically, they're used to plug holes in and stop bleeding. They form a temporary plug prior to blood clotting. Now, they circulate ready to go, but in the blood, nitrous oxide stops them from becoming activated and becoming sticky. And the endothelial cells, the lining of the blood vessels, actually is what stops them from clotting, from coming together. When the endothelial cells are disrupted from trauma, that's when these things become activated at that spot, and that's where they get sticky and form the platelet plug. Looks like this. You notice they come from the same hemocytoblasts. They grow and grow and grow until they become megakaryocytes, which are huge, big cells. And these cells are so big that they push against the sinuses in the capillaries, and then the blood flowing by them pulls little chunks of it off that are the platelets. And it's kind of like when you were a kid, you used to play with Play-Doh, and the machine that you squeeze the Play-Doh out through the shape maker screen, and you would cut off the little bits. It's kind of like macaroni pasta makers, things like that. It's the same sort of thing. These megakaryocytes just keep on growing and growing and growing, and as they push against the holes in the capillaries, little bits of them protrude into the capillaries, and the blood flowing past actually rips off the little chunks that are the platelets.